Chapter 13 of ICD-10-CM is for diseases of the musculoskeletal system and connective tissue. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter M, which is kind of easy to remember, M for musculoskeletal. If you remember from ICD-9, the musculoskeletal codes all started with the number 7. However, there are many more musculoskeletal system codes in ICD-10 as laterality has been added to the majority of the codes. One of the new and important concepts of ICD-10 is that conditions can now be designated as occurring on the right or the left side. This slide contains the rest of the musculoskeletal system sections, which are very similar to the sections in ICD-9. Again, the big change is the addition of codes for conditions occurring on the right and left side. A good rule of thumb for this chapter is that a fifth or sixth character of 1 usually indicates right side, while a fifth or sixth character of 2 usually indicates the left side. However, this is not always the case, just for the majority of the cases. Most of the codes in this chapter are the result of trauma or previous injuries, such as tendinitis, or are chronic conditions such as osteoarthritis. However, if the patient has an acute current injury, such as a shattered pelvis from a car accident, that injury is part of Chapter 19, which is the Injury, Poisoning, and Certain Other Consequences of External Causes chapter. However, there are certain fractures that are coded in this chapter. They are the pathologic fractures, or fractures that are caused by disease, such as neoplasms or osteoporosis. A 7th character is required for these fractures, and we'll take a look at the 7th character options in more detail later in this presentation. If the patient is being treated solely for their pathologic fracture, that fracture must be coded first. You're only going to code for a pathologic fracture when the fracture would not have happened to a healthy bone. For example, a person with osteoporosis might stub their toe and break it, whereas a person without osteoporosis probably would not have broken their toe. Say it was just a simple tap against a wall. That might cause a fracture in the person with osteoporosis, and then that toe fracture is considered a pathologic fracture. I want to talk a little bit more about osteoporosis and fractures caused by it. Osteoporosis affects all bones in the body. Therefore, the codes for osteoporosis without fracture, which is category M81, are not site-specific. However, if the patient does have a fracture that is osteoporosis-related, this codes to category M80, which contains codes for the specific site on the body with the fracture, such as M80.041, age-related osteoporosis with current pathological fracture, right hand. If the patient with osteoporosis was in a bad car accident and broke their pelvis, then this would be coded as a traumatic fracture, not a pathologic fracture. If the patient has a history of osteoporosis-related fractures, Z87.310, personal history of osteoporosis fracture, can be used. Here are our 7th character options for pathologic fractures. A is for initial encounter, meaning the patient is receiving active treatment for the fracture. Therefore, if the patient goes to the orthopedic surgeon and is diagnosed with a fracture, and then the orthopedic surgeon performs surgery on the fracture, both encounters are considered initial encounters as active treatment is being administered. Once the patient comes back after active treatment has been completed for surveillance during the healing process, this is considered a subsequent encounter. Our 4 seventh character options for subsequent encounters include a fracture with routine healing, delayed healing, non-union, or malunion. We'll talk about non-union and malunion in more detail next. Finally, the 7th character S may be used for sequela or late effect of the fracture, such as pain after a fracture has completely healed. Non-union of a fracture means that the fractured bone has not joined back together again, which you can see has taken place in the arm on the bottom of the slide. Treatment usually involves opening the fracture, scraping away the scar tissue, and performing a partial debridement of the bone end with repositioning of the bone. Some type of internal fixation and bone grafting is also usually performed. Malunion means that some type of healing has occurred between the bone pieces, but the fracture pieces are in poor position. The bone on the right is an example of a malunion. To correct this, it is usually necessary to cut the bone, then reposition it, usually with the aid of internal fixation and possibly bone graft. Many malunions may be left without surgical interventions in the hopes that the patient will not have any functional problems. In this chapter, 2 codes will be required for sequela or late effects of pathologic fractures. The first code is for the sequela itself, such as ankle pain. The second code is for the fracture that caused the ankle pain, with a 7th character of S to indicate that the ankle pain is a sequela of the fracture. Let's try an example on the next slide. For our sequela example, we have a patient status post healed left ankle stress fracture, continues to experience significant pain in that ankle with exercise. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is M25.572, pain in left ankle and joints of left foot. To locate this code, start at pain in the alphabetic index and then locate joint. Then look for ankle, which points to M25.57 with a checkbox next to it indicating more digits are required. When we go to the tabular, subcategory M25.57 is for pain in ankle and joints of foot, with codes for right, left, and unspecified. Therefore, the full code is M25.572. The second code is M84.372S, stress fracture, left ankle, sequela. To locate this code, start at fracture in the alphabetic index. Then, believe it or not, you actually have to go to traumatic to find stress fracture, even though stress fractures are part of the musculoskeletal system chapter, not the injury chapter. From there, you're going to look for stress, and then ankle, which points to M84.37, with a checkbox next to it indicating that more digits are required. When we go to the tabular, subcategory M84.37 is for stress fracture, ankle, foot, and toes, with codes for right, left, and unspecified ankle. Therefore, we are at M84.372 for left ankle, but the book indicates that a 7th character is required. Our 7th character options are in a box under subcategory M84.3. Since documentation states that the patient is status post healed fracture and they're now experiencing the pain as a late effect, a 7th character of S for sequela is appropriate. Remember that with sequela coding in this chapter, the sequela itself is coded before the fracture code with the 7th character indicating the current episode of care. For our next example, our assessment plan states osteoporosis causing right ankle fracture with delayed healing. Continue Boniva, continue PT. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is M80.071G, age-related osteoporosis with current pathological fracture, right ankle and foot, subsequent encounter for fracture with delayed healing. To locate this code, start at osteoporosis in the alphabetic index, and then the phrase with current pathological fracture is indented below, which points to M80.00 with a checkbox next to it indicating that more digits are required. When we go to the tabular, subcategory M80.00 is for age-related osteoporosis with current pathological fracture unspecified site. However, we know the site, which is the right ankle, so we therefore need to look below this code to see if there is a subcategory for ankle. M80.07 is for ankle and foot with options for right, left, and unspecified. Therefore, we are at M80.071 for right ankle, but the book indicates that a seventh character is required. Our seventh character options are in a box under category M80. Since documentation states that the fracture has delayed healing, a seventh character of G is appropriate. This next outpatient example was taken from a real note. The assessment states, compression arthralgia of the fingers of the left hand, suggestive of early osteoarthritis. Compression arthralgia of the right knee. Carpal tunnel syndrome of the right arm. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is M79.645, pain in left fingers. To locate this code, start at arthralgia in the alphabetic index, where there is an instructional note stating see also pain, joint. After following these directions, look for finger, which points to M79.64 with a checkbox next to it indicating that more digits are required. When we go to the tabular, subcategory M79.64 is for pain in hand and fingers, with codes for hands and fingers on the right, left, and unspecified. Therefore, the full code is M79.645 for left fingers. The next code is M25.561, pain in right knee. We know from the first answer that arthralgia points to see also pain, joint. After following these directions, look for knee, which points to M25.56, with a checkbox next to it indicating more digits are required. When we go to the tabular, subcategory M25.56 is for pain in knee, with codes for right, left, and unspecified. Therefore, the full code is M25.561 for right knee. The last code is G56.01, carpal tunnel syndrome, right upper limb. To locate this code, start at syndrome in the alphabetic index, then find carpal tunnel. This points to G56.0 with a checkbox next to it indicating more digits are required. When we go to the tabular, subcategory G56.0 is for carpal tunnel with codes for right, left, and unspecified. Therefore, the full code is G56.01 for carpal tunnel occurring on the right side. For this next example, the patient is diagnosed with bacterial septic arthritis, right knee. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is M00.861, arthritis due to other bacteria, right knee. To locate this code, start at arthritis in the alphabetic index and then find septic. Here there is an instructional note stating see arthritis, pyogenic or pyemic. After you follow these directions and are at pyogenic under arthritis, look for bacterial, then knee, which points to M00.86 with a checkbox next to it indicating more digits are required. When we go to the tabular, subcategory M00.86 is for arthritis due to other bacteria, knee, with codes for right, left, and unspecified. Therefore, the full code is M00.861. For this last example, the patient was diagnosed with right upper lobe carcinoma 4 years ago and is seen now for surgical repair of fracture of the shaft of the right femur. 3 months ago, he was diagnosed with metastatic bone cancer, and this fracture is a result of the metastatic disease. There is no longer any evidence of the patient's primary malignancy. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is M84.551A, pathological fracture in neoplastic disease, right femur, initial encounter for fracture. We know this is a pathologic fracture as documentation states that the fracture is a result of the metastatic disease. Therefore, to locate this code, start at fracture, then pathological in the alphabetic index. Next, find the phrase due to, and then neoplastic disease. Indented underneath neoplastic disease are all the anatomic locations of the fractures, and we need femur, which points to M84.55 with a checkbox next to it indicating more digits are required. When we go to the tabular, subcategory M84.55 is for pathological fracture in neoplastic disease, pelvis, and femur. M84.551 is for right femur, but we're not done yet because the book is telling us that a 7th character is required. Since documentation states that the patient is seen for surgical repair of the fracture, which is active treatment, a 7th character of A for initial encounter is appropriate. The next code is C79.51, secondary malignant neoplasm of bone. To find this code, you need to go to the neoplasm table, which for the Optum 2015 ICD-10-CM Expert for Physicians starts on page 321. You would then locate bone, and since the documentation states metastasized bone cancer, the bone cancer is considered a secondary malignancy, and the code in this column should be used, which is C79.51, which you would then confirm in the tabular. The final code is Z85.118, personal history of other malignant neoplasm of bronchus and lung. Since documentation states that there is no longer any evidence of the patient's primary malignancy, which was the right upper lobe carcinoma, the carcinoma is coded as personal history of malignant neoplasm. To locate this code, start at history in the alphabetic index, then locate personal. From there, you would look for malignant neoplasm and then lung, which points to Z85.118, which you would then confirm in the tabular. The sequence of the codes is important for this encounter because the reason for the visit was surgical care of the fracture, therefore the fracture code must go first. Since this fracture was a result of the bone cancer code should immediately follow. Finally, we have a history code, which is not an acute condition, therefore it is going to be last. Now it's time for our quiz. Our first question is, most codes in this chapter have cite and blank designations. The second question is, what 7th character is assigned for a patient receiving active treatment for a pathologic fracture? The last question is true or false. Category M80 is for a patient who has a current pathological fracture. You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is laterality. Remember, this is one of the new concepts of ICD-10 that gives us greater specificity. The answer to the second question is A for initial encounter. The answer to the last question is true. If you went to category M80 in the tabular, you would see that it's for osteoporosis with current pathological fracture. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 13 of ICD-10-CM, Diseases of the Musculoskeletal System and Connective Tissue. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the Vantage Point website at www.vantagepointconsult.com or call us at 203-288-6860.